Today we will discuss general practice in the UK with a cup of coffee, just to discuss the different aspects of general practice, to clarify some confusions for the IMGs, and to give a better idea about the system in the UK, so that before you come in and start working here as a training or a non-training doctor, you do have a better idea about what general practice is and how it is connected to the secondary care. So there are a few important points that we will discuss today, especially what's the difference between a general practice and a GP surgery. What's the difference between a general practice here in the UK and that's back home in Southeast Asian and other non-Western countries? What are the different tests that can be conducted here in the general practice? How you can respond to those tests? What type of patients can you come across in the general practice? And how do you respond to all those different type of presentations? So it's really important for us to have a good idea, so that when we go into the exam situation, we are more clear as into what we are going to do, what we are going to say, how we are going to manage. So the flow of the consultation is quite affected if you're not aware of exactly how the general practice works in the UK. So it's really important for the IMGs before they start working here, and especially before they go and sit for the exam. It's important for them to have a good idea. Let's start by all the points one by one. So what's the difference between general practice and GP surgery? So essentially there's no difference. There are two names for the same place, for the same thing. So when you say that the patient has come to the general practice, or patient has presented to you in the GP surgery, or the patient has come to see you in the surgery, all these three things, they essentially mean the same. It means that you are a GP who is sitting in the general practice and the patient has come to see you. So there's no difference between a GP surgery or a surgery or a general practice. So I hope that is quite clear. Going back to the difference between general practice in the UK and general practice back home. There might be not much structural difference, but the systemic difference is so vast that it becomes a bit difficult for you to understand when you come here and start working as a GP. What do I exactly mean by systemic system? It means the system, how the system works, because the general practices back home in the home countries, if they are private, they are just private. They're not linked to anyone. They are running those practices and they're working on their own, and they're not linked to anyone in the secondary care. We can have some government-based setups where we can have general practices linked to the secondary care as well, but then the subsidy is so small that we don't get enough opportunity to learn a lot in the general practice. So now let's talk about the general practice in the UK. So all the practices in the UK, they are NHS-based practices where multiple doctors are sitting, multiple GPs are sitting in a practice. It can be 3, 5, 10, 15, 20 GPs in a practice. They can be simple GPs or with some special interests, like for example, a GP having special interest in intra-arterial injections, another GP having special interest in dermatology, another having special interest in psychiatry or psychology. So it's really important for us to have an idea about what it is. For example, if you are working in a general practice, you can come across different types of patients. Now, the next question is, what type of patients can we come across in the general practice? For example, you are working as a part of a team in a general practice. You can come across a patient who has presented to you for the first time with a new onset of symptoms. For example, presenting with shoulder pain, early morning shoulder pain associated with stiffness, and you are thinking of it to be maybe rheumatoid arthritis or polymyalgia rheumatica, and you can go on to take a history and start doing those tests. You can come across a patient who might have already been seen by your colleague with such a presentation, and now he's coming to you with the test results and you've never seen him before. So it means that different types of patients can present to you in different ways. Someone who is the first presentation, another patient who can be a second presentation coming for the test results, a third patient who is now going on to be referred to the specialist. So it all depends on what situation you are in when you're dealing with that patient. So it's really important for us to understand we don't always get the patient from the very beginning when he has got his first symptoms. You can be in the practice itself can be in the middle of something in managing that patient. So he can either present to you from the very beginning or can present to you for test results when your colleague has already done the initial investigations and the initial consultation, and or he might be presenting to you for a follow-up with some concerns about that disease process and or about the medications. So it's important to have an idea that the patients coming to you in the general practice, they will not always be the first presentation. It can be a second or a third or a fifth or just a follow-up consultation for some chronic ongoing illness. I hope that's more clear now about how it works. So now let's discuss what are the different blood tests and investigations that can be done in the GP and what cannot be done in the GP. Very important query and confusion that most IMGs face, especially when they are going through the exam situation. So most of the baseline investigations, including full blood count, ESR, CRP, LFTs, RFTs, thyroid function tests, calprotectin levels, RA factor, anti-CCP antibodies, thyroid function tests, you can conduct most of these tests, the urine tests, STI checks. You can go on to do fecal examinations and stuff. So you can do much. It's a huge list of tests that can be done in the GP, but definitely there are some limitations. If there are tests which are only important for the specialist, they may not be in your list to be done. But all that you need to know is that you are able to do all the basic investigations. Where are the x-rays conducted and where do we get the ultrasound done? Are they done in the GP or they are done in the hospital? In the GP, you do not have any x-ray machines and or any ultrasound setup. So all the patients for whom you think you need to do an x-ray, let's suppose for example, for a chronic cough, or as a part of your routine investigation for a chest pain or something, you want to do an x-ray and or you want to do an ultrasound for some abdominal pain or something, you always need to send this patient to the hospital, book him in for this particular investigation, get the test results in a week's time, and then appropriately take actions for that particular problem. I hope that is clear. When do we get the test results back? Very important question. When should we be doing the tests and when not? So many candidates tend to get a bit confused. If a patient is coming to us, should we always do the tests? Should we just sometimes do the tests? Or, for example, if you're sending a patient to the hospital, should we do the tests or not? So to be more clear, when a patient is presenting to you in the GP and you think that this is not an emergency and you want to conduct some investigations, let's suppose, for example, a patient coming to you with symptoms of hyper or hypothyroidism and or a patient presenting to you with tiredness, dizziness, and you've taken a history where you have excluded all the red flags and you think there's nothing sinister and or urgent or immediate referral is not needed, you can always do all the baseline investigations for the patient in the GP. When do we get the test results? How long does it take for the test results to come back? Mostly it's a time span of 2 to 7 days. That's when you can get the test results back in the GP. So what are the situations where we should not be doing any tests for the patient? So the only situation where you should not be doing any tests for the patient is when you are planning to send the patient immediately to the hospital. For example, if a patient has presented to you with an acute chest pain, central crushing chest pain, going to the left shoulder, associated with nausea, vomiting, and you are concerned about a heart attack, an MI, why would you be doing the troponins in the GP? There's no need to do that because you will get the test results back in a week's time, whereas if you send this patient to the hospital immediately, the test results will be back in an hour. So it's really important just to not waste time doing any tests. You always need to send this patient immediately to the hospital. You can ring the hospital, arrange for an ambulance. So those are more important steps that you can take while you're sending this patient to the hospital. So that's all really important. And another question that I often come across from the IMGs is that what medications can be given to the patients in the GP Can we give antidepressants to the patient? Can we give steroids to the patient? What should be done and what not? So I understand it's a bit of difference, obviously, between different countries, your setups, from where you are coming, or the particular setup you've been working back home. So each setup obviously is different from the other. Within the countries or between the countries, we can always meet those differences. To be very clear, most of the general practices are well equipped with emergency medications. For example, to treat a patient with an MI with morphine, oxygen, nitroglycerine, and aspirin. They are well equipped to nebulize a patient in the incidence of an acute asthma attack, or a COPD patient with oxygen, and or if you have to give any anaphylactic adrenaline dose to a patient, child or an adult. They are well equipped with the things that are needed to treat an emergency situation, but obviously not very invasive sort of steps can be taken there. Okay, so now an important aspect which I would really like to share with you. I do come across this query from a lot of GP friends, and for those who are planning to sit for Plab 2 and are working on the UK pathway, they do always get confused whether GPs are able to diagnose depression, whether GPs are able to treat depression. It might be a bit different back home, where most of the patients with depression, either they are not treated because of the stigma of being in a mental health loop, and or they get only treated by someone who doesn't really know them generally, so that they can keep the diagnosis a bit hidden and under the cover. So it's really important for us to understand that depression has become #1 disease in the world, where it has become literally a home for every other person suffering from depression, anxiety, mental health, stress, home-related stress, work-related stress, and it's just going on and on and on, just never-ending sort of a thing. From general practice point of view, it is very, very important for a general practitioner to be able to diagnose the depression well and then manage it in the GP. Why it is so important? Because it's practically impossible for all the patients with depression and anxiety to be sent to the secondary care to be seen by a specialist. That burden can't be just simply met. It's really important for the GPs to be well equipped with their information when they do come across a patient who has got low mood, symptoms of anxiety, problems with sleep, anhedonia, and or they are having any such thoughts of hopelessness and or suicidal ideations. So it's really important for us to equip ourselves with good knowledge about the signs and symptoms of depression and all the medication options that are available for different types of symptoms in depression and anxiety. So yes, GPs can diagnose, they can treat depression. Mostly the patients only need to be sent to the secondary care to be seen by the psychiatrist if you think that it's a small child, anyone below the age of 18 who is suffering depression, and or depression is just not responding to what you are treating with in primary care, and or if you think that this patient has got psychotic features along with depression. So it's really important to send those patients to the secondary care, whereas for all other patients you can treat them in the GP. I hope this video was helpful and it might be a bit useful in clarifying what general practice is, what are the differences between general practice back home and in the UK, and if you've got any other questions or queries about general practice in the UK, and or you want me to add up to anything, just feel free to write down in the comment box. I'll be more than happy to answer all your queries. And also I welcome all the IMGs and other friends who are working in the UK to comment if you want me to make any specific videos on specific topics. I would be more than happy to respond to that at my earliest. If you like this video, click like and subscribe for more useful videos which can help you progress better and come and start working here in the UK. I wish you all the best. Thank you. And enjoy your cup of coffee.